Welcome back to the Critical Care Certification channel. This is the third video in a series of nursing lectures on how to interpret 12-lead EKGs. In this video, we're just going to briefly go back over the parameters of the normal sinus rhythm and show how deviations from that pattern will result in an arrhythmia. So there's our strip, our EKG recording of what normal sinus rhythm looks like. Remember, normal sinus rhythm occurs because the impulse originated in the SA node, which is located where? The right atrium. Our parameters for normal sinus rhythm are a rate between 60 to 100 beats per minute, a regular rhythm, P waves that are normal, a PR interval that is between 0.12 and 0.20 seconds, a QRS duration that is between 0.04 and 0.12 seconds. Any deviation from above is sinus tachycardia, sinus bradycardia, or an arrhythmia. Arrhythmias can arise from problems in the SA node, atrial cells, AV junction, or ventricular cells. In the SA node, the cells can just choose to fire either too slow or too fast, resulting in either sinus bradycardia or sinus tachycardia. Within the atrium itself, outside of the sinus node, cells can choose to fire randomly. You could have one lone cell choosing to do so, which will give you a premature atrial contraction. Or you could have a group of cells outside of the sinus node, but still within the atrium, that choose to fire. When this happens, they usually end up in a re-entrant circuit and loop around and continue to stimulate other cells within the atrium. And so the signal just remains there in a continuous loop. And this is what happens when you have atrial flutter. Okay, just take a look at the internal portions of the heart. And this is demonstrating exactly how the re-entrant circuit continues to keep the impulse from going to the ventricle and remaining up above in the atriums. And what ends up happening is that as you get one or two of these cells starting to conduct, the third starts to conduct, and you just get this chaotic firing, and it's like having wavelets that just continuously are generating those impulses. The AV junctional problems, same thing can happen there. You can, in the AV junction itself, you can have one cell that chooses to fire out of sync, or you could have a group of cells that get caught up in a re-entrant circuit, but you could also have a cell that chooses not to conduct an impulse that did originate from the sinus node. So when you have the cells in the junctional area continuously looping around in a circuit, that's what causes the paroxysmal supraventricular tachycardias. And if the cell chooses not to conduct the impulse that originated from the sinus node, that's what we call an AV junctional block. Ventricular cell problems, they can happen the same way. You can have one cell within the ventricle itself that chooses to fire early, or you could have a group of cells. And when the group of cells fire, just like in the atrium, the same thing happens. They can get caught up in a re-entrant circuit. And this is how you end up with either a premature ventricular contraction, ventricular fibrillation, or ventricular tachycardia. And that is the end of this third video. Hope you have a great day. Thanks for watching.